Welcome to the Booyah Sports Network with your host, Keith Kimberlin.
Hey everybody, and welcome to another episode of the Booyah Sports Network, where we take a look behind the scenes of world of youth sports. Now today we're sitting down with Dr. Chris Bailey of NT Chiropractic. Now, Dr. Bailey's been practicing chiropractic care for over 3 decades, working with patients dealing with everything from chronic back and joint pain to athletes trying to stay healthy, recover properly, and perform at a high level. He also brings an athletic background into his work, including hockey, where physical demands, impact, and recovery side of things are very real. Now in this episode, we're going to be specifically focusing on how chiropractic care fits into youth sports, when it makes sense to bring in an athlete, and how that compares to other options parents typically think about when their kid starts dealing with pain or discomfort. And we'll talk about what's actually happening in the body before the pain shows up, and also why so many young athletes are dealing with issues earlier than they should, and how small problems turn into bigger injuries if they're not addressed right away. Now, so if you're a parent, coach, or athlete trying to make better decisions around injuries, recovery, and long-term health, this is a conversation that should clear up a lot of those questions. Dr. Bailey, thank you for coming on today, and I hope you're prepared for a bunch of questions because I got a few of them for you.
Absolutely, I appreciate it, Keith. Thank you.
Yeah, so let's tell everybody a little bit about yourself, and kind of like what got you into chiropractic.
Well, my story starts up in Canada. Actually, I'm originally from Canada, just north of Minnesota, a small town. Grew up like most Canadians do, playing hockey.
Okay.
Right. With hockey comes a lot of injuries, and I played all the way till I was about 18. Suffered, broken bones and sprains and strains and head injuries and all these different. Up there wasn't much for doctors. They just told you to keep on going. One day, a friend of mine said, "Hey, you need to have headaches," and my after a concussion from playing. And a friend of mine said, "Hey, you need to go see the local chiropractor. He drives from another city in here once a week." And I had no idea what a chiropractor was. And I'm like, okay, if he can help me with my headaches, that'd be great. So I went to see him. This guy was about 5'3", the little guy. He was all jacked up, had tape around his, and he looked at me and he said, "You're a hockey player, aren't you?" I said, "Yeah." He said, he asked me what I did, and I said, "Well, I went straight into the boards head first, knocked me out, and now I have headaches." He goes, "Well,
Wow.
You're not supposed to do that." All right. So he shot an x-ray, actually, which I was really surprised. He shot an x-ray, and he showed me on the x-ray what had happened to one of my vertebrae in my neck. And he says, "This is where your headache's coming from. And what I'm going to do is I'm going to do what's called an adjustment to make that joint or make that bone move properly again, and your headaches are going to go away." And I said, "Okay, let's give it a try." He adjusted me. That night, I had no headaches. And after that, I became a patient of his for probably the next 6 years. And it was just phenomenal. I went to college, and I thought I was going to be a teacher like my dad, an engineer like my brother. And I went in for an adjustment one day, and I said, I'm not feeling this engineering thing. I'm more of a people person, and this engineering is all sitting down with numbers. And he said, "You need to be a chiropractor. You're athletic, right? You're strong. You're smart. You need to go to chiropractic school." So I looked into it, and the best school in the country, or actually best school in the world, was down here in Dallas.
So why chiropractic, not like being like I don't know the difference. Like for people out there that don't know, what is a chiropractor versus like a doctor or whatever, or like not a doctor, but you're a doctor, but I'm just saying, what's the difference between like chiropractic and the whatever the opposing thing to the chiropractic is?
So generally there's chiropractic, we're called a DC, a doctor of chiropractic. Then there's medical doctors, which are MDs.
Okay.
And then there's DOs, which are doctors of osteopath. All right.
Okay.
So generally, we go to school, take very similar courses, all the way up to when medical doctors would then specialize in pharmaceuticals. They'd more into maybe like neurosurgery and cardiovascular stuff, and DOs, very, very similar. They take a little bit of the functional health classes that we take, but we really specialize then into the function of the body without having to use any surgeries or any medications. So that's kind of the main difference, between us and the medical doctors. But one main thing was our best friends growing up, the dad was a medical doctor, and people always ask me, why didn't you become a medical doctor? And I looked at his, we always went over to their house to hang out and play and whatnot. He was never home.
Oh, wow.
On Saturdays, Sundays, he'd get called out in the middle of the night to go deliver babies. He was very well respected, and he had an amazing career, but I just thought it's really hard on the family. And I'm a family man myself, and being a chiropractor, you go in I go in at 6 o'clock in the morning and I'm done by 6 o'clock at night. And then I go home and I've got the weekends to be a dad.
So is there like as far as chiropractic is concerned, I mean, I personally have never been to a chiropractor. I mean, my wife is gone, and sometimes she'd go and they do like some deep tissue thing, and she it made me so sick or whatever, because it actually helped, maybe because it like I guess they did some kind of deep tissue kind of stuff for an adjustment. But like whenever you're, I guess, a chiropractor, like is there a different thought process, like from a regular doctor versus a chiropractor? Like, do you have different philosophies, or I guess you're focusing on the actual mechanics of the body? Is that really what chiropractic is?
Right, yeah. And with our field as well, I mean, there's so many, when you're talking about physical medicine, there's so many different ways to go as far as practitioners. And I mean, I'm a mechanical chiropractor. I look at the body functionally. It moves, when we were talking about symmetry earlier, is that we want the body to equal right side, left side. When you talk about athletes, you don't want to have one side more dominant muscular wise than one other side. Medical doctors, when it comes to injuries, MDs will assess that very similar to how we do orthopedic tests, neurological tests, and then they'll refer them out for rehabilitation through physical therapy. All right, and we also use physical therapy modalities as well, but we incorporate it, which is unique to us. Osteopaths do it a little bit. But what we do is we're able to mobilize dysfunctions. So a good example of that is a pitcher, all right? Somebody who's throwing a ball, and we could all agree that the dynamics of throwing a ball is very, very difficult. It incorporates every joint from your shoulder, actually your pelvis, all the way down to your hands. And as if there is a joint, there's 100 joints between holding a ball and throwing it. And what can happen is if there is one joint, two joints, 5 joints that are not functioning properly, maybe they're functioning at 50%, maybe they're functioning at 2%, that ball is not going to come out as fast. It's not going to come out as straight or as curved. And that's what chiropractic does, is we're trained to find these dysfunctions and we clear them up.
So you make the correction. So what do you basically, I mean, what are you looking for? Like if I came in, or if a kid comes in, say a pitcher, and I mean, they come in saying, hey, like normally when you go to a doctor, you're like, oh, my shoulder hurts or whatever. They do the same thing with you. They say my shoulder hurts. And then you try to, you ask them a series of questions. I mean, what are you looking for when someone comes in?
Yeah, sometimes, most often, let's say maybe 60% of the time, athletes, let's go with young athletes, come in experiencing pain. But then I actually have a professional pitcher that I'm treating right now, and he comes into me based on his mechanics, because I've trained him over the years where, he's like, Doc, I'm not throwing the ball. My slider is just not doing what it needs to do. I have no pain. I've gone to the team physical therapist. I've gone to the trainers and done massage. What can you do for me? All right. And here, what it was with him, he's a closer, so he throws the ball 102 miles an hour.
Whoa.
He was throwing it down into the 80s. He couldn't get it back up, and 6'9", 295 pound lefty.
And you're able to discern what caused that?
With him, I assessed everything and looked at everything, because mechanics in mind, and what it was his pelvis. All right, this guy's a giant man. Yeah. His pelvis was on one side of what's called the sacroiliac joint, was fixated and stuck. So when you're throwing a ball, you have to have hip rotation. That's where your power comes from. While that rotation was stopping before it was fully going through, I gave him 2 adjustments, 102 miles an hour again.
Oh my gosh.
Because it's all based on function. And that's where when you talk about youth athletes is that, you know, they're like little weeds growing. And what happens is when they formulate these dysfunctions in their spine or in their shoulders, their knees, their hips, or wherever, they're going to mold to that. Where people that are athletes that are maybe older, they've already kind of gone through all of that molding. And the risk that kids have, and this is why I treat a lot of young athletes, is then they formulate things like scoliosis, which is curvature to the spine. And some of these are induced from little accidents.
Proper technique or
not technique,
improper
but little
technique?
injuries that they've had. So these athletes have been, playing their sport, and we can all agree that.
So they tweak their style to avoid the pain or something, and maybe that throws everything off, and it just makes it worse, and it just starts to exacerbate. I mean, is that the deal?
Exactly. Yeah. They will compensate, and next thing you know, 6 months down the road, they're having Tommy John surgery because they had to compensate.
Change something, yeah.
Yeah, and that's where preventative care, which what we do as chiropractors, is so important, and so important to these kids.
So you're not really like I guess when you go to, you say when you have pain, you say, hey, take an Advil or something, to ease the pain. You're not really, I guess you're technically treating the pain, but you're not treating the pain as much as you are seeing what's causing the pain. Like you're getting to the root cause of it more, it sounds like.
Oh, absolutely, yeah. I mean, pain is sometimes a distractor because you can have these athletes, so they're 15 years old and their football coach is yelling at them saying, you need to tough it up. They're afraid to tell you that they hurt. All right. So it's our job to see where the problem is. And you could have, like I said, with Tommy John's, you could have pain right here, but the problem, like I said before, may be in your pelvis because it's all off. I mean, you could pick any sport and a dysfunction is going to cause the pain later on.
So if a young athlete starts feeling pain, I mean, what should they do as far as, I have a note here, like, what should a parent do? Like, so, because a parent, they see their kid in pain and they automatically go, oh, we're going to go to Rapid Med, or we're going to go to the ER or whatever.
Right.
I mean, what should they think about? Like when they start seeing when their kid's in pain, and it may be because they felt like they threw their arm out like a pitcher, or it could be anybody, a soccer player or whatever. I mean, what do you recommend there? Like when a parent starts, or when a kid starts complaining, I mean, what do you recommend?
Yeah, I mean, the general rule that I have, because I've been a sideline football chiropractor for many years. I was a trainer on a high level hockey team for 15 years. And my number one rule is if a bone is sticking out of the skin, you're not coming to see me. All right?
Exactly.
You're going to the hospital, and you're going to go. You're going to go right away. But if your son, like just say for instance, he's playing football, and you're watching him, and man, he catches the ball and he gets just lambasted, and he is hurting, and he wakes up in the morning, and it wasn't bad enough to take him out of the game. He wakes up in the morning, and you watch him come into the kitchen, and he's limping a little bit, and you're like, you okay? And he's like, oh yeah, I'll be fine.
Yeah, all boys are going to do that, right?
Right.
Mine did.
Did you ice it last night? Yeah, no, I went to sleep. Okay. All right. So he comes home from school that day and he's still limping. All right. Best thing to do is get him in that next day. All right. Sure. Let us evaluate him for these injuries. Okay. And because you could have a partially torn ACL in the knee, and we're able to detect that. We'll get you right to the orthopedic. I refer to orthopedics all the time, and then they get them to the PT and they strengthen that ACL so it doesn't tear. So to be preventative, because the main, we have to always remember with youth sports or with these kids is we're not trying to make the best 12-year-old athlete. We're trying to make the healthiest 20-year-old athlete.
Okay.
And that's a big thing to remember is these parents think that Tom Brady was Tom Brady at 12 years old. No.
So basically, you already touched on it, but when does it make sense to go to a chiropractor versus a medical doctor? So you already touched on it. You said there's a bone sticking out, you go. But like if he walked in hobbling in the morning, what would make the parent, or what, when the parent's looking at that and they see their kids in pain and they're like, are you okay? And he's like, yeah, I'm good. At what point do they say, yeah, I'm going to go to a chiropractor, or I'm going to go to a doctor? I mean, should they start with you maybe? And I mean, should that be where they start? Unless there's something like bruising or something,
Right.
physically they can see that there's something like the arm's like crooked or something. So there's probably some structural damage maybe, and they want to go get an x-ray, because that's everybody's knee-jerk reaction, at least it was for us. We're like, let's go get it x-rayed and make sure it's not broken or what have you, which I guess that's what you do when you go to the ER, or you go to like a rapid med or some clinic or something. But I mean, maybe we should tweak our thought process a little bit, and maybe not just rush off to that, and maybe look into getting chiropractic help. And can you go to any chiropractor? I mean, or is everybody trained the same, or is there differences?
I think as a parent, as I'm a parent of 3 boys, and 2 of my boys played football. One was a middle linebacker, 225-pound, bench pressing 375 pounds.
Wow.
My other boy was a running back, and then I have a basketball golfer. But, you as parents, you have to observe your child. If they're playing a sport like football and they get hit, you're watching your kid all the time. You see them get hit helmet to helmet. Maybe the coach missed it. Maybe the trainer. Maybe I missed it on the sideline. But you as the parent, you're not going to miss that because you're watching your kid. And you keep your eye, and then he comes home at night and you're like, hey, how you feeling? I've got a little bit of a headache. Okay.
Mm-hmm.
Okay. So you're thinking, okay, maybe he got his bell rang. That's probably the time, if you're worried about a concussion, you maybe even go to the emergency room right away.
Right.
Okay. But if it's I tweaked my knee, and he's able to get up and walk around. The beautiful thing about chiropractic is we will get you in. All right. The ones who are trained, and answer your question, are we all trained the same? I mean, we all go to school, just like all medical doctors go to school, and we're taking the same courses. But, some chiros will specialize in, like you said, some of the soft tissue stuff.
Right.
Some will, they'll get into nutrition. Some will get into different things. Chiropractors like me, we are mechanics of the body. So you get injured. We are the experts in assessing these injuries. So we have kids that played football on Friday night, and the trainer calls us and says, hey, listen, these parents really don't want to go to the emergency room because it's so expensive. Why not come and see you? And it's so much more cost effective to come and see us than going to the emergency room. We do x-rays. So I x-ray every football season hundreds of kids. They come into my clinic just for that x-ray to make sure their pinky's not broken, all right, their spine's not broken, their leg's not broken. So you have to do your homework on finding the right chiropractor.
Right. Because not all of them are going to have an x-ray machine in their office, right?
No.
I mean, I remember we took our kids to our boys to the chiropractor, and they have all these, like the one we went to, I'm not going to say any names or whatever, but they had like some weird like clicking thing, like a gun, which, I mean, maybe that's all legit stuff. I mean, it was just weird to me. It was kind of strange to me. And I think there's a stigma that I think people need to get rid of, that stigma, and find a good chiropractor for some of these things instead of going directly to like the ER or going someplace where they may not know how to diagnose it. So you guys, being mechanics of the body, so to speak, if you see something that's not right, you actually do refer them to people who are the medical doctors, the people that can fix. Like if you notice, I mean, because when you do an x-ray, you see a broken bone, you obviously know because you did the x-ray. But if it's not broken, you have maybe methods that can fix it, or make an adjustment right there on
absolutely,
site.
yeah. So we almost act as the triage, which is really nice for these parents, because it comes down to, and the schools too, because sometimes the schools are responsible for some of the care, the money for the care, and it's so much less expensive to come and see us. We'll shoot an x-ray, and an x-ray may be $25 to $50 instead of $1,000 like at the.
So basically, the parents don't need to just knee jerk and just immediately say, and this is obvious, obviously, but that just say, hey, we're gonna go to the ER, or we're gonna go to you can come to a chiropractor if it's the right one. So how would somebody go about knowing if it's the right one? Because I mean, with a doctor, like if you go to say Rapid Med versus I don't know all the name of the clinics, but there's all these seems like these clinics are just popping up everywhere, to where you can just go in, if you have insurance, pay $40-50 or whatever, and they say, hey, what's wrong, and you tell them, and then they look at you and they do all their things, and ultimately I think they refer you out too. So you're thinking that, so if I'm going into a chiropractor's office, how do I know I'm at the right one or at the wrong one? Is there a way to tell?
Yeah, I mean, the best rule of thumb that I always tell whenever my patients are moving to, to Houston or Austin or wherever, they always ask me, do you know somebody there? And if I do, I'll refer them there. But is when you're going to, for your first time ever to a chiropractor, do your homework, okay? Ask your friends, ask your family, who do they go to? Because what we do is communication. And to answer your question from before too, on why some of these chiropractors, the stigma and all that, whatnot, is their ability to communicate. All right, we are the top of the line, and this comes from all my medical doctor friends and cohorts, that we are the masters of communication. We have to communicate to the level of that patient what we're doing, why we're doing it, and how we're doing it. All right, and it's so important to be a good communicator. So ask your friends, who do they go see? Let's say you don't have any of that ability to do that. When you call the office, this is my rule of thumb. Ask them, does your doctor have x-ray facilities in clinic, or does he do x-rays? Some of them will say, no, you don't need x-rays. Don't go there. All right. We could sit here for another hour and I could tell you things I found on x-rays that are scary. I mean, I'll tell one story. I had a 14-year-old elite soccer player. She was, being looked at, one of the top schools in our area, being looked at to go to play college already as a sophomore. And she came in and her back was hurting. And I was like, all right, we need x-ray. So we x-rayed, and she had a full-term baby inside her.
Shut up. Oh my gosh.
That was straight to the emergency room.
Oh my gosh, seriously.
And she didn't know she was pregnant because she was so athletic that it wasn't showing.
Unbelievable.
It was a big shock to her dad that, when he was in there, but
yeah, I can imagine.
But if I would have done certain modalities, we do a lot of therapy modalities in our clinic, like ultrasound. I mean, it's amazing for you sprain your neck, your elbow, and you've got swelling. Ice is good. Ultrasound is, 10 to 25 times more penetrable and faster than ice is getting rid of that inflammation. We treat herniated discs. That's a big thing. Football players are always herniating a disc in their neck. And what we do, or weightlifters, or any sport, and we're able to actually take that disc that is bulging, it's like a balloon being squished, and we're able to bring that disc material back in using this what's called decompression therapy unit. And I've done over 70,000 of them over the years, and
wow,
on myself as well, and my wife. But it's very, very effective.
Sorry.
But yeah, so lots of stories that I could tell you, but that's the number one, is how big is the practice? All right. I mean, you're going to go to a practice that there's a single doctor and he's in a single room and doesn't have any staff members. And, you might want to go on to somebody who's a little bit larger that,
yeah,
it's been there for a while.
So if I'm a parent and I've never been to a chiropractor before, is it a good idea to take a kid that's maybe not injured, just take them to a chiropractor and say, hey, do you do like baseline analysis on people? Like, do you ever just look at someone and say, okay, take notes of them and say, okay, this see, everything's good mechanically with this kid, and this, so if something does get messed up, you can figure it out later? Or
Oh, absolutely. Yeah.
should somebody take their kid? Like if a parent wanted to find a chiropractor, is it good to go to a chiropractor before they're injured, or you just wait until they're injured and then take them to the chiropractor?
Oh, no, absolutely before, because we can prevent injuries from happening by refunctionalizing the body, or those joints that are moving at 10 or 50%. that increases your propensity for injury, right? So if we can find those joints in a 12-year-old who's, probably fallen off their bike or, had these things that have happened or played their sport that they're playing, and we can basically refunctionalize these fixations, they're called. I mean, they're going to be playing or developing and growing at their 90 to 100%. All right. But the big thing, to answer your question on, is there a way to detect that? Yeah, we do scoliosis screenings for and probably 15 of the schools around our clinic. And we go in and look at, we have, an apparatus that we use, and we can look at this youth and see a high shoulder here, a high pelvis like this, a knee that goes in like this. And then we say, hey, listen, you've got these findings. We need them to come in. Let's do an x-ray. And sure enough, they'll have scoliosis.
Wow.
Right? So that's a big thing. So then what we can do is if we can...
Is it treatable?
Oh, yeah. If we can find scoliosis, there's different kinds of scoliosis.
Yeah.
But if we can find a injury-related or a functional type of scoliosis, I've taken a patient with a 32-degree here and a 40-degree down into the lower part of the back, and their pelvis was off by 25 millimeters. And in 4 months, 100% straightened their spine.
Just by doing whatever the therapy you do.
I have protocols for scoliosis, but and 15 years later, he's still a patient of mine. Now he's probably in his mid 30s, and we X-ray him every 2 years, and he's still perfectly straight.
Wow.
And to me, that's, I don't want to be as extreme as saying it's saving their life, but it really is, because somebody with that bad of scoliosis is going to have herniated discs. They're going to have compression fractures. They're going to have all these different things as they get older. It's going to make them miserable. Or for girls trying to have babies, when their pelvis is off like this and closing down.
Right.
We do a lot of prenatal care. We have OBs in our city that send us their pregnant ladies to turn the babies.
Oh my goodness.
When they're
that's kind of cool.
Yeah, it's.
So you got to know you got to know a lot about the body to be doing that kind of stuff. So
You do.
So it's not like you don't just
And you don't just
dabble
go
in
to
that.
any chiropractor too. That's the thing, is you have to listen to your friends, or even, a lot of our referrals come from, we have 8 OBs in OB-GYNs in our town that send them in to us because we've done 100 of their patients in the past. So you want to ask questions. Most of them comes your case.
So if you're not properly aligned, and you're not, I'm not saying, when I say aligned, who knows what that is except for a chiropractor, but there's a good chance if you took your kid in who's say a pitcher, or maybe they could be a bowler, I guess, or a soccer player, or a volleyball player, or a softball player. If they go in, there's a good chance that if you saw something that could be corrected, it could actually increase their I guess athletic output. Like it can make them better, maybe. Like you said it earlier, you talked about the pitcher. I mean, he's a 100 mile an hour pitcher pitching 80. You make a little adjustment, he's back to 100 miles an hour. So there's a possibility that you could take your kid to, NT Chiropractic. You can analyze them and say, hey, your hip's a little misaligned, and maybe all of a sudden their kick's better, or maybe their throw's faster, or whatever.
100%. Another example is we have the University at UNT, the university up there. They have an amazing basketball team, and a few years back, I treated almost the entire team. They would come in before the game, like whenever there's a home game. They would come in during that. I'd always have them come in at lunchtime because they're all 6'7", 6'9", and all the kids in the office would be like, getting their autographs and stuff. So I let them come in at lunchtime, and I treat all of them. And sometimes it was psychosomatic, all right, which is fine. But sometimes it was, and they would say that they could move laterally, which in basketball we all know that lateral movement is very, very important. And they could jump higher, faster. After I did the treatments, because I would do certain treatments on their knees to tighten up their what are called their collateral ligaments.
Right.
When their collateral ligaments, it increases the stability of their legs. So when they're doing lateral whatnot, it's quicker and it's more stable. Because once you lose stability, that lateral motion, you get this, and all of a sudden that's when you have injuries.
Yeah. So how often would somebody come in? Like if you like, say if you're a person that it just advised to come in like once a month, once a week? Like I say, if you're an advanced volleyball player, an advanced softball player, or baseball player, or football player, or whatever, is it smart to kind of go in regularly just to make sure everything's good, or should you wait until you start feeling some weird stuff?
Yeah. With athletes, it's typically they come in and they're hurting. All right. So then we're using protocols just like physical therapists, just like any physical medicine doctor does. We set that patient up on a protocol to rehabilitate them. All right. That's if they're hurting. So they go through, like, maybe it's 3 times a week for 4 to 6 weeks, get them through that injury. And then what we do is we keep them, maybe during the football season. I usually get my football players to come in, usually once a week. Let's a quarterback. I have a Division I quarterback right now. He drove in this weekend and came over to my house and got treated because the chiropractor at the school scared him.
Oh, wow.
All right. And when I checked him, he actually reversed some of the stuff that I had done. So, I mean, you have to be, again, very, very careful with who you go to see. But, I mean, these young athletes, they go through their injuries, but then once the season is finished, all right, the football season, the baseball season is finished, that is when you want to do your recovery care. Well, there's some sports like cheerleading, competitive cheerleading, volleyball. They don't take time off.
Yeah, that's true.
And that's a whole nother episode that we could talk about, because that is doing the youth athlete no service at all. I mean, most of those they're gonna end up having a chronic type of illness or injury that's gonna eventually take them out of the game. And that goes back to, are we trying to make a 12-year-old the best 12-year-old athlete? Or are we trying to set them up to being a 20-year-old Division I, Division II, Division III, whatever athlete that is healthy? All right.
I love it.
Once you get to a certain point in athleticism, let's say that they're 18 years old, they're about to go Division I, those athletes are pretty much all as athletic as the next guy.
Right.
What determines them going to the pros, and there's some studies that have done on this, is what's the difference between a pro athlete that was this good and an athlete who was this good that didn't make it their pro, is their ability to recover from injury. All right, that is the major key. And if somebody's had preventative care, whether it was through chiropractic or just really good training, they're going to be able to recover faster and more secure than the other ones.
So what could a young athlete be doing, like on the daily, that could actually hurt? Like, it actually hurts their it just works against them. It goes against, like, is there things that they shouldn't be doing? Or I guess it's sports specific there, but I mean, is there anything that, like, you would recommend that people stop doing? Like, is there anything you know of that people are doing? They're like, oh gosh, these people they're doing this kind of care or this kind of treatment or this kind of workout, and it's actually working against them. It's hurting them. It's throwing them off. Is there anything?
I think that, when I was an athlete young, and it was all about being the toughest athlete. Even at 12, even at 15, your coach we weren't even allowed to have water during practice and he would make you, if you weren't throwing up, you weren't working as hard. And that's different. I mean, nowadays it's so important for those young athletes to be, if they're injured, they need to recover and rehabilitate. And that's the key, is if you know that, you're an offensive lineman and you tore up your wrist that game before, and then you're going to go into the gym in the weight room the next morning and throw up 300 pounds on a bench press, that's only going to hurt you later on. All right. So youth athletes need to recover properly. That's the main key. And communicate. Coaches don't. Sometimes coaches don't see the injuries. All right. They're trying to win. They're trying to keep the team together. I mean, they're not trained to see these injuries. All right. And the athlete has to be their own advocate.
So if a parent is unsure what to do when their kid's in pain, like, so what would you tell them? What would you tell them?
If they're unsure what to do, don't get onto YouTube. Don't get onto Google. bring them in right away. I mean, for instance, one of the doctors that works for me did a 2-year stint with an Olympic team, and he went all over the world with this Olympic team. It was track and field, and so he's trained in observing and figuring out these injuries. Let the expert tell you what to do with that injury. Like I said, if the bone is sticking out of the skin, get into the emergency room.
Right.
But sometimes run into the emergency room, or sometimes making an appointment with your orthopedic, it may take 3 weeks to get in. All right. Most chiropractors, my rule is, if I ever hear one of my front desk assistants telling a patient on the phone, "Oh yeah, you can't get in until next week," all right, they might not have a job with me very, very much longer, right? We see sometimes 150 to 200 patients in a day in my clinic. And that's because everybody who needs care gets in. And I tell my doctors that work for me is, we all are in agreement that if it's 6 o'clock and we have a patient that is walking in, we're staying.
Wow.
Right? That is the commitment that
awesome.
you need to find in a doctor.
So how would somebody? I know you're in North Texas. You're here in Dallas-Fort Worth area, but like, our podcast is being seen nationwide. But if you're in the area, how would people find you? What's the best way to find Dr. Bailey?
Well, for me, you can Google, or we're in Denton. Denton's where University of North Texas is.
Right.
Downtown Dallas, where we're at right now. We're about 20 minutes north of that. But yeah, you can.
And it's NT Chiropractic, and you got a website?
Yeah, ntchiropractic.com. We're in Denton. We're open 5 days a week. I see patients on weekends sometimes, and so the other doctors.
So if someone's hurt, let's say they're playing a tournament over the weekend, like if we see it all the time, like my girls were in a tournament this weekend. But if someone's needing care on a weekend, when they reach out to you, like say call, is there an answering service that do you contact people on the weekends, or how do you handle that?
Yeah, absolutely. No, we have our phones go to a service, and usually it's one of my staff members that's on call for the weekend.
Okay.
And we get a call, and I pick up the phone. I'll call the parent, and they'll be like, "Listen, my daughter was playing volleyball, and she came down and her ankle," and they'll take a picture and send me they'll text me a picture of her ankle, and I'll tell them what to do. All right. Or if somebody was fell off of a bike, and they're like, "Oh my gosh, we have a game on Monday," and they're the starting quarterback, will he be able to play?
Right.
And in an instance like that, one of us will most likely go in and see him.
Well, that's awesome. Yeah. So I guess NT Chiropractic, Dr. Bailey, thank you for coming out today and meeting with me and talking to me about this, because this is something that I've always wanted to personally know myself, but because we always knee jerk and we want to take our kid to the ER, we want to take them to someone that don't really know. And when we're talking about youth sports, really it's more of a physical thing. Obviously, like you said, we've said it 10 times, you got a bone hanging out, go to the ER. But if there's something that's tweaked, hurting, or whatever, I'm thinking maybe my first move is going to be coming to see you at the chiropractor's office.
Absolutely.
What about parents, by the way? Is you work on the?
Oh,
because they're hanging out on the sidelines, and they're some of those. You watch. I follow people all the time, and you'll see them, walking crooked or whatever. So I guess they can come into a chiropractor, and sometimes you can fix that right up.
Cradle to the grave is what we say. We, I have patients that are literally, I've adjusted my kids at 5 minutes old. And
5 minutes old.
I've adjusted somebody who was 103 years old.
Wow.
Okay, so, and of course you have to be trained in that. The delivery OB-GYN actually watched me adjust she asked if she could watch me. And it was amazing. So I did what we did. There's what people think when they watch YouTube, there's this cracking type of stuff.
And twisting and all
it's
that.
completely different when you adjust a baby. And I did my treatment, and then the doctor did what's called the APGAR test. And she was like, neurologically, your baby scored almost perfect. And she
Wow.
became amazed. She ended up becoming a patient of mine too.
Wow.
Because everything that we do to increase function also increases the neurological system. It stimulates the nervous system. All right. And there's long-term studies on that as well. And there's the school here in Dallas. Actually, the doctor that I bought my practice from 27 years ago, he was the leading research chiropractor, and they won actually a Nobel Prize on
Wow.
on one of the researches that they did. But yeah, we could treat anybody and everybody. Everybody that has a spine, all right, is is welcome in my clinic.
So if you had one thing to say to the parents out there, what's something you would say to somebody right now that's never heard or is skeptical about chiropractic or chiropractic care? They're not sure about it. They've never really considered it because they maybe think it's not, for them. What would you tell them?
Really is finding one that your friends use, that your family use, because it's trust. All right. I mean, the communication that we have to do as a chiropractor because of that skepticism is very, very important. All right. Some medical doctors just walk in the room, here's your script, and that's fine. They get the instant
To
kind
treat
of
the
respect,
symptom,
but-
not the cause.
right. And I mean, we all, and I'm some chiropractors are MD bashers and some MDs are chiropractic bashers. I'm all about just whatever's best for the kids, but it's finding the right chiropractor who's going to meet your expectations as a parent. All right, is very, very important. So just you finding one, do your homework. I mean, and there's nothing to say that. I mean, we offer free consultations. So if they don't offer a free consultation to meet the doctor, and when you're in there, you ask them questions. If they're trying to sell you, some land up in Oklahoma or something, you probably don't want to stay there. But if you get that warm, fuzzy feeling that they're there to treat your children or treat you, then go for it. I mean, oh my gosh, I've done over 4 million treatments in my career.
Wow.
And
Impressive.
every one of them was based on trust. All right. Because you go to the wrong doctor. All right. You've heard of people got the wrong legs cut off.
Yeah.
Or you go to the wrong chiropractor and they adjust your bone the wrong way. I mean, it could injure you. It could hurt you.
Yeah.
All right. So be an advocate for your children. Be an advocate for yourself. Find somebody who you trust.
So maybe if you got something going on, maybe you should check out the chiropractic, I guess, option first, because it could increase their athletic ability in whatever sport they're in, obviously. And we may find something, you may find something wrong with somebody that they didn't even know was a problem.
Yeah. I have one last story. I remember I was in school, went to school here in Dallas, and to make some money on the side, I was valet parking at a restaurant in Las Colinas. It was where all like the Dallas Cowboys hung out, and so I got to park some really nice cars. And so one day at lunchtime, there wasn't very many people there, and out came the most famous Dallas Cowboy at that time. I won't say his name, but he sat there, and there's nobody else around. And he asked me, he says, "You're a young fella. Why are you parking cars?" It was amazing that a football player asked me that. I said, "Well, I'm actually in chiropractic school." And he goes, "Oh my gosh, let me tell you a story about my chiropractor. I see him every single day during the season and sometimes twice a day on the off season." And I was like, "Really? That's amazing." I said, "Who's your chiropractor?" And he told me who it was. And his chiropractor was actually the son of the chiropractor that owned and started our school, Dr. Parker.
Okay.
And we talked for a little while. It was very interesting, very encouraging, and he couldn't stop talking about how much he loved his chiropractor. And that's what you'll find with a lot of people who go to their chiropractor. They love them. I mean,
That's awesome.
I've put on about 25 pounds just from the cookies and the cakes that my patients bring me in. But the next day, it was a couple of days later, we're talking in the middle of the Dallas Morning News, and it was, the sports section was an entire article from this Dallas Cowboy and his chiropractor.
Wow.
I mean, I don't know if our conversation prompted that or if maybe he was already working up
Sure
to that.
seems like a coincidence.
It was amazing. It was amazing. And then that cowboy is probably the most famous cowboy of
That's
all
awesome.
time.
So I'm hoping I can get you back on again so we can talk
I would
maybe
love to.
something specific to a specific sport. But that's going to wind down this episode of the Booyah Sports Network. Guys, thanks for watching, and I hope you learned a little bit. And if you have any questions about chiropractic or chiropractic services, and if you're in the North Texas area, reach out to Dr. Bailey. And until then, guys, until the next episode, please like, share, shoot this to anybody you know, because we need your help to kind of grow the channel. And until next time, we'll see you in the next one. Booyah.